Diabetes is so common in India that there's a good chance we all know someone with diabetes. This might create a sense of fear among some, especially someone with a big sweet tooth. If you would be diagnosed with diabetes in the future, or if you already have it and are unaware, and as your SugarFit health coach today, I, Venus, will be telling you about some of the common yet hidden symptoms of diabetes that you should look out for. First, we need to understand the different types of diabetes so we can break down the symptoms specifically for each type. Mainly, there are three categories. 1. Type 1 diabetes, 2. Type 2 diabetes, and the third one is gestational diabetes. Let's start with the first category. Type 1 diabetes, also known as juvenile or autoimmune diabetes, is a type of chronic diabetes that prevents the body from producing insulin to supply glucose to the whole body. Some of its early symptoms are lack of proper vision, which is caused by fluctuating blood glucose levels that induce swelling in the eye's lenses. You might notice your vision starting to get blurry and lose its functionality as the shape of the lens changes. If you find rushing yourself to pee often than usual, it could be a symptom of diabetes as the kidneys try to remove the extra sugar caused by high blood sugar levels in your blood by taking it out. You might notice your urine to be frothy, dark and bloody with pain in the lower back and even increased urinary tract infections. If you're peeing frequently, you're bound to feel dehydrated and that will leave you feeling thirstier than usual. So, watch out if you've been feeling this way lately. It could be a sign of undetected diabetes. Extreme hunger is another early symptom of diabetes that should not be ignored. The reason behind this for any normal person is that the food consumed by them gets converted into glucose so that the body is always energy filled, ready to take on the day. But for a person with diabetes, the pancreas is unable to produce enough insulin for the body, which doesn't allow the glucose to get transferred to the body, thus creating a lack of energy. This makes them feel hungry and tired too often. Coming to type 2 diabetes, which is also the most common type of diabetes, it affects the body by shutting its ability to use the insulin produced by the pancreas. Hidden symptoms of type 2 diabetes to watch out for are skin and yeast infections. They generally occur around the mouth or armpits, causing redness, itchiness, a burning sensation, and even soreness. If you have low immunity, your chances of contracting skin infections are even higher. Yeast infections are also very common when you are a person with diabetes, as the high sugar levels in your blood and the urine provides nutrients to the yeast and basically help them grow. If you notice that your wounds and injuries are taking longer than usual to heal, it could be a symptom of diabetes. This is because increased glucose or sugar levels in your blood restrict the proper blood circulation, which causes the nerve damage and damage in the blood vessels. Hence, the more time your wounds and injury take to heal. Another common symptom is experiencing pain and numbness in the hands and feet. This is also primarily due to the impaired blood flow and damaged nerves, which leads to pain and numbness in hands and feet for those with type 2 diabetes. This sort of nerve damage is also known as neuropathy and can worsen if ignored. The third type of diabetes is gestational diabetes and is seen to occur in pregnant women. It affects the way through which our body utilizes insulin and can trigger high or low levels of blood sugar, which in turn can hamper the overall health of the pregnant mother and the unborn baby. Some of the earliest symptoms of gestational diabetes are experiencing hormonal changes during pregnancy, gaining weight or being overweight. Having a family history of diabetes makes you more prone to gestational diabetes. Being a pregnant woman of 30 years of age or older also makes you more likely to suffer from gestational diabetes. Experiencing limited production of insulin in the body is another sign. Some other general symptoms that can be caught on early for diabetes are high blood pressure and cholesterol is observed very often in people with diabetes. The poor utilization of insulin causes narrowing and hardening of the arteries, which increases your blood pressure. Due to this, most people with diabetes experience hypertension, a high risk of heart disease and memory issues. As an expert, I highly recommend you manage your blood pressure and cholesterol with the help of lifestyle interventions, exercises, or medications to prevent further damage. Experiencing brain health issues is also a symptom of diabetes. The irregular blood flow control to the brain affects your intellectual performance and the ability to plan, organize, remember things, prioritize, or pay attention. So, if you've been finding it difficult to focus or perform regular mental functions, it could be a sign to get yourself checked for diabetes. Gum diseases can be a sign of having diabetes as the high blood sugar levels modify the collagen in all the tissues. The gums and the bones are infected, leading to painful chewing and even potentially losing a tooth. Diabetes not only worsens your gums but also causes inflammation and deep abscesses in the gums. If you've been facing difficulty during intimacy lately, it could be a sign of diabetes. Erectile dysfunctions among men are extremely common with diabetes in the long run due to the changes in the blood vessels and the nerve supply to the penis, especially if you are over the age of 40. When it comes to women, you might notice sexual difficulties like lubrication issues and issues with achieving orgasms. Another symptom of diabetes is hearing loss. While it is not surprising to lose hearing as we age, it is more likely to happen with a person with diabetes than the general population. It is caused by high blood sugar levels, damaging the blood vessels in the inner ear, similar to the way it damages the blood vessels in the eyes and the kidneys. Older women with diabetes have a higher chance of developing hearing loss compared to those with diabetes of the same age. Obstructive sleep apnea is a type of sleep disorder that occurs when your throat muscles relax and block the airways during the sleep. Almost 50% of people with diabetes experience this, especially ones that are overweight. If you're facing this issue, you have a high chance of developing diabetes in the future. I'd suggest you try and treat this by keeping your airways open at night by using a device or wearing a mouthpiece that will help you push the jaw forward. So, to conclude this video, I'd like to remind you that even though the early symptoms of diabetes can be difficult to notice, you should always be aware of the changes in your body and what is causing it. And in case you've been experiencing any above signs and symptoms, then I would strongly suggest you to visit your doctor and get a proper checkup done. Keep your blood glucose levels in line by eating right, exercising, maintaining proper weight, and monitoring cholesterol and blood pressure levels. If you have any questions about the signs and symptoms of diabetes, then feel free to drop them below and we'll get to it soon. Don't forget to subscribe to our channel. Until next time.